Today we will talk about a topic that affects millions of men around the world, but unfortunately, often goes unnoticed. This is prostate health. Every year, more than 268,000 men in the United States face a life-changing diagnosis. These are not just numbers. There are destinies, families, and close people behind them. Prostate problems concern not only men themselves, but also those around them: wives, children, friends. This issue is so important that it cannot be postponed for later. And here's the thing: few people talk about the prostate, but early detection of prostate problems will save your lives. Therefore, today we will reveal the key signs that every man should pay attention to. After all, your health is the main thing, and taking care of it should not cause embarrassment or fear. Why is it important to talk about this right now? Because early detection of prostate problems can literally save lives. The sooner you notice the alarming symptoms and consult a doctor, the higher the chances of successful treatment. Skipping these signs is like ignoring an alarm when a fire has already started. But this video is not just about awareness. It's about taking your health into your own hands. We want to give you the tools so that you can notice in time if something goes wrong and take action. Right now, you have the opportunity to find out what to pay attention to and which symptoms cannot be ignored. Watch the video to the end, because ahead we will tell you about 10 key signs that every man should know. This will be an important step for you or your loved ones. The first symptom is difficulty urinating. Imagine a situation. You want to go to the toilet, but you feel that it takes more time and effort than usual. It is difficult to start urinating, the jet is weak, and even after going to the toilet, it seems that the bladder has not emptied completely. Or suddenly, there is an urgent desire to go to the toilet, but nothing happens. These are clear signs that something is wrong with the prostate. The prostate is located next to the urethra, the tube through which urine is excreted. When the prostate enlarges, it presses on the urethra, which makes it difficult for urine to pass. Not only is this inconvenient, but it can also be a sign of a serious problem. The most important thing to remember is not to ignore these symptoms. Many people think that it will pass by itself, but early diagnosis can significantly affect the outcome of treatment. If you or your loved ones notice such difficulties, it is better to consult a doctor. The second symptom is a weakening of the force of the urine stream. When you notice that the urine stream has become weaker and you have to strain to empty your bladder, this is a signal that something is wrong. This is not just a temporary discomfort, but a potentially important prostate-related symptom. When the prostate increases, it presses on the urethra again, as we said earlier. As a result, the flow of urine becomes weaker, and it seems that you need to make an effort to go to the toilet. It is important to understand that a weakened jet can be caused by benign conditions such as benign prostatic hyperplasia. However, such symptoms can also indicate more serious diseases, including prostate cancer. The third symptom is blood in the urine, or hematuria. If, when going to the toilet, you notice that the urine has acquired a pink, red, or even brownish hue, this is a clear sign that something is wrong in the body. Blood in the urine is always a reason for serious attention. When cancers begin to develop in the prostate, they can penetrate into neighboring tissues and urinary tract, which leads to the appearance of blood in the urine. This is not just a cosmetic defect, it is a serious signal from the body that needs to be immediately addressed. It is important to remember, blood in the urine is always an alarming symptom, and it cannot be ignored. Regardless of whether it is accompanied by pain or not, you need to see a doctor as so. The fifth symptom is constant pain in the lower back, hips, or upper thighs. Chronic pain in these areas, especially if it persists and becomes permanent, may not just be fatigue or muscle tension. Constant pain in the lower back, Hips or upper thighs may indicate that prostate cancer has begun to spread to the bones. Such symptoms may be a sign that the cancer has spread beyond the prostate, and the sooner the diagnosis is made, the better the chances of successful treatment. A doctor may use visual tests such as X-rays, CT scans, MRI scans, or bone scans to identify the cause of pain and check for cancer in the bones. The sixth symptom is painful ejaculation. Pain during or after ejaculation is not only unpleasant, but also alarming. This pain is often accompanied by discomfort and may indicate prostate problems. Inflammation of the prostate or even cancer disrupts its normal function, which leads to painful sensations during ejaculation. Prostatitis or cancer causes inflammation and irritation, which makes the ejaculation process painful. Consult a doctor to find out the cause of the pain and get the necessary treatment. Prostate health is important for overall well-being and quality of life, and it is best to solve such problems in the early stages. The seventh symptom is frequent pain or stiffness in the lower back or hips. Pain in the lower back or hips, especially if it increases over time and becomes more noticeable during physical activity, is an alarming sign. Constant pain or stiffness in these areas is not just fatigue or overwork. Do not wait until the pain becomes unbearable. Consult a doctor for help. Your health is important, and taking care of it should be timely. The eighth symptom is unexplained weight loss and decreased appetite. If you suddenly start losing weight for no apparent reason and notice that your appetite has decreased significantly, this may be an alarming sign. Such weight loss and lack of desire to eat are not related to diets or changes in habits. When prostate cancer develops and spreads, it affects metabolism and muscle mass. As a result, your body begins to lose weight, despite the fact that you eat as usual. This is due to the fact that advanced stages of cancer disrupt normal processes in the body, which leads to a decrease in appetite and weight loss. The ninth symptom is fatigue. Debilitating fatigue, which does not go away even after a full rest, can be an important sign. This constant fatigue is not just due to lack of sleep or overload, it is deeper and may indicate more serious problems. When cancer develops, it requires more energy from the body to fight the disease. This leads to increased metabolic needs, which causes constant fatigue and exhaustion, even if you rest and sleep enough. The 10th symptom is swelling of the legs or pelvic area. If you notice that your legs or pelvic area have become swollen, this may be an alarm signal. Edema occurs when fluid is trapped in the tissues, and this indicates problems with the lymphatic vessels. When cancer spreads to the lymph nodes, it blocks the normal outflow of fluid. This leads to edema, as the fluid cannot be effectively excreted from the body. If you notice swelling, especially if it does not go away and becomes more pronounced, it requires urgent medical attention. Edema may indicate an advanced stage of cancer, and the earlier the diagnosis is made, the more likely it is to be successfully treated. Do not delay your visit to the doctor. Your health and timely treatment are crucial. All of these symptoms are worrisome, but it's important to remember that they don't always mean cancer. Sometimes it can be something less serious, but checking yourself at an early stage is always better than ignoring the body's signals. Regular medical checks and careful attention to your health can make a huge difference. The good news is that medicine is making huge strides forward today. Early detection of problems significantly increases the chances of